Here we go. My name is Jack Abel, and I have the privilege of working as the Senior Director of Spiritual Care at Caron Treatment Centers in Pennsylvania. And for me, it's the middle of the afternoon. So I'm going to say good afternoon. If it's not afternoon for you, whatever time of day, welcome. I'm a little bit new to the use of the platform and the webinar experience. So if I seem a little clumsy or whatever, I ask you to bear with me. We have a subject to spend time with today that I think is just tremendously important, meaningful, and helpful in clinical care and addiction treatment. And I'm going to tell you just a little bit about me and where I'm coming from and the background that I bring to making this presentation. What we're talking about is the use of ritual in use disorder care. And it's something I have a great deal of passion about. But before we even do that, I'm going to just role model a little bit and ask you to take one moment in reflection on what it is that we are entertaining, and to allow the thought that perhaps our experience too can have a little bit of a ritual quality. And that doesn't mean that we're going to be dancing or I'm going to be lighting candles or anything, although all of those are ritual things are meaningful. But this is an engagement that's oriented towards transformation. And I want to name that and claim it. And thank you for being a part of it. And I'll welcome you here. Also, one or two other logistical things. There is a Q&A option, hopefully on your screen. And you can post a question if something comes up that you would really like to see me address. I'm going to walk my way through the presentation rather than take questions midstream. So if you can put your question in a form that's whole in and of itself, that would be great. But I will try to take time at the end of the presentation to attend to any questions we've accumulated along the way. And also at the very close, our web facilitator, Jesse, is going to prompt you with a 3-question survey. So promise you that's all it is, and we would love to have you participate as a way of giving us some feedback about your experience and what we could do perhaps better. So as you can see, in changing the slide, I have been working in addiction treatment chaplaincy for over 10 years. I have both a Master's of Divinity and an MBA, so I had a business background. I was a congregational pastor, and I pursued a lot of academic study, part of which I got really interested in academic theology around ritual and ritual studies and the anthropology of ritual practice. So I think different than some chaplains, this is something that has really been important to me, is to think about the shamanic, priestly, sacramental, or ritual aspect of encountering people in their journey. And I don't think always our clinicians are mindful of their work in that way, and yet I like to think that sometimes each of us probably has had moments that we thought of in work with our patients that was profound and deep and sacred. And so that's where we are. I will also just like to disclose right at the front, a person myself in long-term recovery, and I began my recovery describing myself as an atheist. So went from atheism to faith, but in a way that was shaped by my 12-step experience to be pretty open-minded. So I'm very comfortable in working with people in different faith and spiritual traditions. So again, so glad you're here, excited to spend the time together. I have some stuff accumulated right around me to help me. So I'm going to do my best to give you my full attention. But if I seem distracted, it's because I'm just trying to stay on point. What I'm going to do in the time that we're going to spend together is talk first about when, where, and what ritual kind of things can happen, and the context in which I'm envisioning you as my audience, I can't see you, but I know you're out there, is use disorder treatment, addiction care. And I know that takes a lot of different faces. In the treatment center where I work, we have detox, and we have early residential treatment, and then we have longer-term residential treatment. We have an outpatient component. We work with people in alumni and longer-term relationships. And so it depends a lot on where people are in terms of just beginning. We also have family members, and there can be ritual moments that present themselves at various levels of the treatment continuum. I think that's the continuum of care is how people usually talk about that. And I'll cite some of them, but I may not be thinking specifically of your context, but hopefully the things that we have to say will be helpful to you. What, to me, invites thinking in a ritual frame of mind is when change is in focus, and hopefully change is in focus in much of what we do. And you may have been trained to think about change in a relation to a certain model or technique. It might be a psychodynamic model, a CBT or something like that. It might be Prochaska Di Clementi, stages of change. It might be motivational interviewing. These are all modalities that are evidence-based and common in our field. I'm going to ask you to also think about it in the general case. If my encounter with the patient has value, then there will be a before and after quality to it. And that invites some degree of ritual thought. So what do I mean by ritual is something I want to start with as we look at that. What are ritual moments and ritual opportunities? And in particular, if you'll notice at the bottom of the inset box, I want to rule out one use of the word. We do talk in behavioral health treatment sometimes about people having ritual behaviors like counting or whatever in compulsivity disorders. And I think that's a perfectly fine use of the term, but it's not the one that I have in view. Where I am thinking is, first of all, religious rituals that people participate in their lives as part of belonging in various forms of community. That might be sweat lodge or church or synagogue, mosque, temple, for people in those mainstream traditions that we think about. It could be a private devotional time in the morning, reading magazines or newsletters, or acts of private devotion like individual rosary use. But also, as you'll see in the slide background, there's an image that's, I think, one of the spontaneous memorials that has created itself around one of the disastrous events in the history of our country's many disasters and shootings that we are becoming more and more routine and familiar with. And what we find driving along highways and visiting sites like Ground Zero in New York City is that people enact visual memorials, and the creating of these memorials is a way of trying to address something that's happening in them in the moment. So as we move through the slides, little bullets there, from religious to secular to therapeutic, all of the previous types of ritual, I would argue, have therapeutic value. But the other thing that's interesting is that in addition to our use in society in religious and secular contexts of ritual, there is a place in on the couch, as it were, and in the group therapy room, or in our lecture and clinical process for the incorporation of ritual. And of course, that's where we're headed. The other thing that is important from a background standpoint in terms of context for ritual to be experienced is that probably the large majority of those who are online at the moment are in some way have to be in dialogue in your work with the 12-step universe. And that's a world, it's a culture, it's a context, it's a tradition. One of my most helpful influences, a great guy named Fred Holmquist, who was at Hazelden for a very, very long time, was somebody I used to speak with about AA as a wisdom tradition. And whether or not the 12 steps are directly incorporated in the treatment environment that you work in, and whether or not you're also incorporating things like refuge recovery or SMART or LifeRing or any of these other para 12-step kind of options, there's the things I'm going to say would probably still apply. I remember when I was beginning in seminary and I'd already been a part of recovery community for a long time, one of my professors who was teaching us about ritual and worship described AA as a ritualless community. And I knew right in my heart that he was clearly not really familiar, because it turns out that I think you almost cannot have community without ritual. That ritual is a thing that human beings do. We ritualize. It's part of our pattern matching. Oh, thanks to the commenter for saying I've misspelled Al-Anon. I apologize. The shape of a 12-step meeting and certain aspects of the journey of participating in the meeting and things when I was first getting into my recovery, they used to talk about cleaning ashtrays. Today, most of the meetings I attend are non-smoking, which I'm really grateful for and relieved about. But there are all kinds of ritual elements that are built into the 12-step recovery experience. And just a couple of weeks ago in a service that I was facilitating, I was talking about the use of the third step prayer. This is a common, not universal, but common practice in some of the areas in which I'm familiar with recovery, where people take a citation of a prayer from the AA Big Book that has to do with turning one's life and will over to a power greater than oneself, and have people kneel and read and recite the prayer either with a sponsor in a group setting as a kind of a milestone moment. I used to do a lecture specifically on the fifth step, which is the sharing with a sponsor or other mentor or guide and one's higher power of the inventories that have been prepared in the fourth step. And I think if you take close attention to the way this is described in the AA literature, there's a really good, strong case to be made that the fifth step experience is initiatory, that it's one of these moments like baptism in Christianity or confirmation as a rite in Christian upbringing, or bar mitzvah in the Jewish tradition, where one becomes a kind of an adult or a full-fledged participant in the community. And I don't think, again, that many people think about this fifth step in a ritual way, but it definitely has these qualities. And I think as I talk a little bit more about the theory of ritual, you might want to reflect back on that. And I don't want to overread the slide, but so the 9th step, the 11th step, the 12th step, coffee and meal times, 12-step study groups with their formulaic prayers, anniversary coins, the formats of meetings, welcome, this is the blah, blah, blah group of Narcotics Anonymous, and we're happy to welcome you. Each of these include ritual aspects, and there are ways in which participants in a recovery journey become ritually oriented. They know when the meeting is happening. They learn to announce themselves with my name is Jack and I'm a whatever it is, and getting that corporate response back from the community. So ritual is not by any means something that we have to entirely invent or create for people in recovery. It exists out there, and sometimes it's as simple as calling attention to it and affirming it and supporting it as part of the process that is the most wise and effective way of incorporating ritual in treatment. So I think this is one of the mistakes that I think that people make sometimes, is to overcomplicate or complicate or try too hard when the wisdom tradition itself may have the elements and the forms to create ritual experience. I feel like one thing I failed to mention on the slide here before I move forward on, but that comes to my mind at the moment also, is the teachings in this wisdom tradition around forgiveness and the practice of praying for people that we resent for a period of time. These are the kind of things, if you're literate in the recovery tradition and its rites and rituals, and you can incorporate that as treatment interventions in your work, you're doing a lot. You're educating and preparing the candidate in the treatment environment for the ritual culture that they're going to be exposed to out in the treatment, out in the regular world. And you're leveraging the history of effectiveness and meaning that was out there in your work. So you're making powerful ties that are really useful and worthwhile. What happens when we ask beyond that, what kind of therapeutic rituals would be relevant for a presentation like this? So one of the things that I do is I train people to do addiction chaplaincy. And I encourage the people that we work with to think about the spiritual care encounter as ritual from beginning to end, from the moment the entry into the office space or meeting area begins to the departure conclusion of the encounter. So a spiritual consult in our world is in itself a ritual experience, while it may not include burning or candle lighting or music or any of those things. And I hope that's kind of an aha for at least some of you, is to allow yourself the permission to invest the entire encounter experience that you have with your clients with the dimension of sacredness and with ritual shape and feeling. But also, and then the formulas and the structures of ritual, which we'll get to before we're finished today, can help you shape the time you spend. If you spend 30 minutes, 45 minutes, 60 minutes, however long your scheduled interactions are, even 15 minutes or 5 minutes with a client or patient, if you have this mindfulness that this is a ritual experience, then that can inform the way that you spend and experience the movement through the time. Again, trying to role model, I was trying to think about this as a ritual experience in which we're having an encounter. And right now I'm past the initiatory phase and trying to deepen the rapport that you and I have. And it's not easy because you're not giving me any eye contact at all. So you should feel sorry for me. I can't see. But let me talk a little bit more then about what happens when clients are engaged in substance use disorder care. There are some very common components of treatment that have ritual shape, feel, and experience. The ones that are listed here, grief letters. So I suspect you know that and maybe have recommended such things, letter writing. It's important to note that a grief letter might be a letter to the lost relationship, person, or thing. It may also be a letter from the lost relationship, person, or thing, or it could be a kind of third-party thing where one imagines a higher power communicating to one or both parties. You can use non-dominant hand, left handwriting, that kind of thing. There's a lot of variety. In grief, evidence-based bereavement consulting practice, the use of grief letters is one of the most significant things that moves the needle in terms of people reporting significance and helping them work through their process. So while it's important to be mindful if you have people who are dyslexic or very gifted in some other modes of expression, that we want to incorporate that thinking, the grief letters merit some attention, and they have a ritual feel. Especially what one has to do is not just write the letter, but decide what you're going to do with it. So we're going to share it in group, you're going to share it with an individual person, you're going to burn, shred, or otherwise discard it, or you're going to bury it. What happens? Shame release is there. I say that. I think I'm going to mention at the end too, if I have time, burning bowl ceremonies. There's an image of paper being burned there. The burning bowl kind of ceremony is often used for shame release activities. It can be used for other things. Commitment is an example of something else that the burning can be used for, but often this is for something that I feel is kind of bound to me and that I wish to release. I suspect there are people on the webinar who are very strong in the incorporation of art and music in their therapeutic environments, and people who are very limited in it. But I suspect also most of us have been exposed to some of that, and something as simple as doing a family diagram or a collage can be ritual experience. Amends has its place in the treatment environment, at least in the place where I work, often around family or around community and interpersonal relationship issues that arise in peer relations. So, if there's a theft from one roommate to another, or there's disrespect, and we help people work those things through. And maybe we say that that's happening in community meaning, and we're just going to deal with this. But it can be powerful and therapeutic to shape that encounter using ritual thought and language, because it helps mark the sense of completion and transition in the resolution of those issues. I'm stealing those words from the bottom of the slide. We also have graduation rites. At the facility where I work, there's a large bell, and people ring the bell as they're completing certain milestones. There may be even phases or transitions and levels within stages of your treatment milieu. You might describe a patient as being a tier 1 or a phase 1 or phase 2 or phase 3, and how we mark the movement from those stages or levels are ritual opportunities, sometimes not taken advantage of. Couple more things, and then I want to get more into kind of the how-to side of the time that we're going to spend. This slide with these dancing figures behind it begins to get at the why of ritual. When we merely do our first step prep, if that's a piece that you do, or our timeline, or we get a cost letter from a family member, or we finish and wait for the transportation to our next level of care, or we are done our IOP, or whatever it is, if the framing of that experience lacks a ritual quality, we may be undershooting the mark. And when we add the sense of ritual quality and experience, we enhance and support our underlying objective, which is to successfully facilitate and encourage authentic transformation in the individual who is in our care. We want the experience not to be merely respite and not to be waste of time, but for people to really be able to look back on their experience and work with us and say, as a result of my investment in this experience, I am truly different. My life is truly different. My substance use is no longer the instrument of harm in myself and others that it used to be, and perhaps even more. I understand who I am. I'm living a life of greater meaning and purpose. I have better relationships. So that's what the ritualizing of treatment experiences can help contribute to, is the enacting and ascribing of meaning and the demarcation of transformation in people's experience. So this is not just fluff, and it's not insignificant or unsubstantial. It, in fact, can be crucial in solidifying the transformative elements without being disrespectful of the other aspects of your tradition or craft. So as an addiction counselor, or as a psychologist, or in whatever other role you may have, and I don't know what the professions are that are represented in our audience, I don't mean to take away from the training and discipline that you know, but when you bring ritual component to it, you can help cement and anchor and create momentum out of transformation, which I hope is what we're all communally striving for in our patients' experience. Just a little bit more theory. one of the most insightful and persisting elements from my academic studies many years ago in ritual theory, something that's stayed with me and helped me think about this in my work, is the work of Victor Turner, who was an anthropologist and pioneer in ritual studies. And I don't want to get lost in it, but I want to recall a few things that Victor Turner contributes to the thinking about ritual experience, because they point both to how tricky this can be to do and why I think some of us are afraid of this. Like, it's like we almost don't want to make the encounter sacred because we don't know how to do it, and we're worried that we're not a shaman or priest or minister or rabbi, and we're also a little bit afraid of something that happens when ritual opens. And Victor Turner's work helps put language around that. He talks about ritual experience as liminal experience. Limen is threshold, and one of the phrases that Turner brings to the table, and others like Ryan Grimes after him carried forward, was this idea that in the middle of ritual experience, we are betwixt and between. We are no longer where we were previously, and we are not quite yet where we wish to become. And this liminal quality of ritual experience is it's almost I want to say diagnostic. It's you know you're in ritual when you feel like you're suddenly in a new place. I think of Joseph Campbell and his work on hero journey and the crossing of thresholds being essential to the understanding of that model. And so there's a crossing of threshold into ritual experience. And one could argue that detox and early treatment is profoundly liminal. It really is weird. And there is a sense in richly liminal experiences of a kind of Twilight Zone-ishness. I also, it comes to mind the weirdness of ICU experience, the weirdness of serious illness of other forms like cancer, hearing the doctors say you have cancer, the weirdness of maybe having the ring in your pocket and wanting to ask the person to marry you. There is a quality of differentness, the day of death and a significant loss, when suddenly you find out that someone that you cared about is no longer living. And there's something odd, you would say, about that day. This is something that if you become adept at ritual, you know to be friendly to rather than to be uncomfortable with and pull back from. This is taking it to a place of fertility and a certain kind of perhaps bewilderment. And one of the elements of it may be that you too are not exactly sure where this is going to go or what this is going to do. And the graphic behind the screen has a person in the middle of a leap. And I want to encourage you not to shy away from ritual just because it has this liminal quality, because this is part of its power. Two other ideas that Victor Turner brings to the table in understanding ritual. One is an observation that he makes about anti-structure. And what he means by this, as I understood it, was that once one enters the ritual sphere, often there is a profound inversion or absence of the hierarchical structures that operated previously. So whoever was boss and whoever was peon and whoever had authority and whatever lines and status elements were in play, those can often be turned upside down. I'm reminded in my early recovery of some of the people who had so much wisdom to offer, but who society would have viewed as not highly functioning, or not having great status. And yet in the 12-step communities, we stopped and listened when they spoke, because they spoke with a different kind of authority. And you may notice, for example, you may have somebody who's a doctor or a politician or a lawyer or a musician or someone like that who's in your care environment. And in this environment, it's no longer important, like who or what they are at some level. On the other hand, it can be very important in terms of understanding how they experience that process. And the very loss of this sense of power and authority may be one of the things that you have to care for. But when ritual gets really deep, everybody becomes denuded, made. They have to shed the old garments of stole or robe or hat or whatever, and prepare to don new ones. And within the context of the ritual community, there may be informal or temporary roles of leadership that emerge, and all of that's part of the process, especially when you're talking about multiple people participating in it. And the last thing to say from the Victor Turner school of thought is this lovely word that he talks about, communitas. And this is related to the liminality and anti-structure. These all go together. What happens when people, I was paying attention to the news this morning, and there was a airplane flight that returned to Philadelphia airport after having an engine blowout, and there was a loss of life in the incident. And I don't know, but I suspect that these qualities that we're speaking about also happen in calamity at times. That the poor folks on that airline were betwixt and between, and that they have a curious bondedness now from having had the experience that they've had together. And but there may have been people who were really important in negotiating that experience to the degree it was negotiated, perhaps I won't say more beautifully or elegantly to others, and it also was horrific. I think ritual and trauma have a kind of a kinship here also, because many people find themselves in this kind of space through profound deconstruction of roles and assets that they have had in their lives. So I know we've suddenly gotten heavy, and I appreciate your staying with me. And I'm going to get to theory about how to do this. That's another thing that I wanted to have the chance to spend some time with you about is you'll see at the bottom, at the top of the slide, the word clumsy. And I don't mean any disrespect to anyone who's watching. If I say something that you've had experience with, I will tell you I've done things that I later thought were really clumsy too. But I think that this is a thing that we can begin to practice, and also that if we study and have some certain sensibilities towards, we can do better. And that sometimes if we don't bring enough skill, elegance, grace, intelligence, and daring to the field of ritual, then it may lack its effectiveness. It may feel perfunctory, or so that's this next slide. Perhaps the easiest way for me to talk about ritual ineffectiveness is to suggest that one of the largest ways in which people make errors or could improve is because of errors that I would call errors of fit. So here's an example. Every patient in our treatment center does a letter of their addiction. We burn the letters and I play a song on my phone. You may even have a person in your treatment center who's doing this. It may be you on the call, and you would say, and And there are always several people who come up to me and go, that is so wonderful. But what I want to gently bring to your attention is that the people who don't say anything about it have a continuum of different experiences. Some of them have also had great experience in that event, but don't say anything about it. Some have had maybe a neutral experience, and some may even have what they would call a critical experience. Like, I was like, hey, it worked for me. And the presumption that the letter writing, the burning, and the song on the phone is a formula that works for everybody is the thing I want to challenge. And when you look at large group rituals that are highly effective, they often have various points of entry and ways for people to access the meaning so that their different preferences and styles can get fed. The larger the group, in some sense, the richer the ritual experience may want to be. And that doesn't mean it has to be deeply more complex, but I'll talk about the different ways you can kind of play to these varieties. I wait for a moment to have them kneel in front of the chair and group and say the third step prayer. This, I'm calling to mind someone that I work with who, not only this, but a number of kind of formulaic tricks in the bag kind of thing. It's like, oh, this is, let me bring out my intervention for this moment. And I think it's great to have that bag of tricks, but there's a caution about thinking that that's the only way for a person to initiate surrender in a recovery community. And because it works for some does not mean it will work for all. Also, a fit error has to do not with just, it worked for me, so it should work for you, or I've seen it work for a bunch of people, so it should work for everybody. But disrespecting the cultural context in which the client exists and thinks about ritual. I have a personal pet peeve around the imposition of mindfulness without respect to the deep contemplative life of many of the other wisdom traditions. And people who I know who are very adept in mindfulness studies out of various schools would be the first to say that there are Jewish and Catholic and Hindu and Buddhist variations that are true to the core aspects of mindfulness as you might encounter them in MBSR, refuge recovery, or DBT, for example, three contexts where we see this a lot. So really tailoring and providing entry for people to place ritual in the context of ritual meaning in their own lives is something that I know takes a lot of work, but which helps deepen the impact and the utility and value of it for people. The last one is perhaps obvious, but it is an error that people make, and dyslexia is one. Also trauma and woundedness. Sometimes we may want someone to entertain or participate in an activity without realizing how profoundly triggering it may be, and so there's homework to do in doing ritual right. And one of the things that can be the most, I think, it's a good test for a person who wants to ask about whether their ritual toolkit is wide and broad enough, is Howard Gardner's theory of multiple intelligences. So I have a slide here. This suggests that there are 8 types of human intelligence. There are originally were 7 that were proposed by Gardner, and today there's actually a 9th that's also been added to this list. But it's more what I'm trying to say about it's both strength and challenge. So you have a person who's word smart, you may want to lean into the verbal and allow them to write or read as part of ritual. Whereas if you have a person who is dyslexic or illiterate, then a word-based ritual can be debilitating, unsuccessful, or shaming rather than reinforcing and motivating. So, and there's just no way to fix that. It works for some, and it's hard for others. So we're accountable for our interventions, not accountable for the outcomes, but we're accountable for the work that we do. And in this case, we're accountable for doing some homework to find out, hey, do words work for you? Do you like to read? Is reading good for you, or is it not? Well, no, but I go to the gym all the time. Hey, then that person is body smart, or I love to play or listen to music. I'm music smart. So tailoring individual ritual creation to play to people's strengths and to not shame or debilitate or limit through people's areas of disability is what I'm asking you to be mindful of. And when you're doing larger groups, to try to provide components that play to the different types of intelligence. If you think about opera or the Roman Mass or the contemporary praise service or the Jewish synagogue or a Passover supper, these events all have a richness to them that if you think hard, you can even find the math and logic sometimes, like in the calendar, the setting, or the numbers of people, or the choreography. And it's the integration of these multi-intelligence components and multimedia components that help. The other thing I noticed at the bottom of the slide, it says age and other biomedical factors. It's tricky because if you have 15 people in your unit and one of them can't walk and you want to take people on a little pilgrimage, we have a 12-step journey on our campus or whatever, I have to be mindful of that. I have to think about maybe I can get a wheelchair or what I can do. So people have limitations, they have strengths, they have cultural, contextual experiences, and the more we do take that into account, the richer their experience is likely to be. Okay, I know I'm like already at 43 minutes. I'm gonna get us to the end of our presentation and to see if we have any more questions, but I promised in my opening, I would also talk a little bit about how to. And fortunately, I can tell you that my how-to wisdom, I think, is actually rather simple. And I think that fits because there is a complex underlayer to this. I mentioned earlier in my long monologue here, Joseph Campbell and the work on Hero's Journey. And I think Joseph Campbell has something like 17 different marker points on the monomyth. But we're going to think much more simply about this as many of the best ritual thinkers have helped sharpen the pencil and kind of clarify. Ritual has an underlying anatomy or structure that is repeated over and over again in different contexts and forms. And when ritual is complex, usually it's because it's nested or layered multiple sort of iterations of the core concept that I'm going to share with you. And I'd love to tell you that this concept is mysterious and abstruse, and that only through the benefit of these great thinkers like those, but actually I think it's quite simple. In understanding it deeply, what one would say is that to change, you have to have like a beginning, a middle, and an end. And so you have to start to set out, you have to kind of figure something out, and then eventually you have to sort of name and claim that you've entered a transformative existence. So you can take Prochaska di Clementi as an example, and you could impose that or other theories and models of change. The basic idea of beginning, middle, and end is something I do think is underlying obvious element. Arnold von Gennep, I think the period of time is around 1920, writes in French, Clique de Passage, and his work gets picked up by Victor Turner and then later by people like Ron Grimes and Gregory Dix and Joseph Campbell. This idea of a rite of passage as the creation of a new identity with an ending to the old self, a liminal middle experience, and then the claiming and incorporation of the new self is, this is really what ritual seeks to do. It seeks to move us away from a past through a transformational experience to adopt and identify a future. And so all of those words, some of them I've already used previously, are indicated in the illustration there. And the slide here helps tease out just a little bit deeper. I would say that Gregory Dix is the person that most informs my thinking about this, and he was a Roman Catholic scholar of worship forms. But I think this has a profound universality, is that the liminal middle of ritual experience can have this kind of two-part shape as well. So I'm proposing that you think about ritual and creating rituals using this four-part framework. And I would hope, after all of this blab, that if you were asked later what the webinar gave you, you could maybe even go right back to this in your mind and be able to say to someone, I heard this crazy dude, and he said that rituals tended to have four pieces. Getting started and finishing were pieces of the ritual, but that in the middle of the ritual experience, there was a deepening component and there was an acting component. And I think that you may very well be skeptical. I was skeptical, but I think this is really quite observable, and it has a simplicity to it that then we can create the word complexify later if we wish. So I want to just spend a little bit of time on each of those four elements. Getting started, and that's powerful. Like to say to your client or patient, I want you to think of our session as an experience that can be transformational for you, is an interesting way to start. Or after having had the session, call to mind that there's an element of forgiveness or letting go or healing or something that you want to create a ritual around. To say, we're going to start right now with a ritual process that's going to help you to mark this change. I had a clinician once tell me that they were going to help me with some forgiveness in the moment. And I was struck by the power and the audacity of his claim, but I will tell you also that his claiming the power and intention helped make the experience real. So I have that question there, self-review. How will we know we have begun? That's a good question. And if this is the commencement ceremony for your treatment experience, it might be a big deal. If it's a letting go thing for one-on-one session that's got to take the whole session is 45 minutes and it's 40 minutes into it and you want to do it, it could be a 5-minute thing. But what you want to do is make sure that you actually start. And I have the singing bowl and the candle there. Those are things like lighting a candle, ringing a bowl, opening a devotional and reading a reading, asking a person to close their eyes and assume a comfortable posture. Anything like that that helps us know that we've actually started is all it takes to do the beginning. You don't have to spend a huge amount of time getting started. You just have to name and claim it. Deepening, and the contrast between, I don't mean to make you crazy, but deepening and enacting change is this insight that I think the sacred community brings to ritual theory that I think is quite profound, is that once you've said that you have the intention of ritual change, it still makes sense to amplify or unpack or expand or contextualize before doing the ritual action. So we say we're beginning the ritual, and then we have to kind of understand what the ritual means. In a funeral, it may be a eulogy. In the wedding, it may be the declaration of intention. Do you plan to marry this woman? And in the fourth and fifth step, it's the reading of the fourth step is the deepening. And then it's the conversation at the end and after that is the action piece. And this is where creativity is your responsibility to make it rich for many people or to make it appropriate for just one person. But it's something that I think people miss. It's something that they jump right from start to action, and then the action is not contextualized, and the person is trying to figure out afterwards, why was that meaningful and why and how. I think that, and it could be just in silence. It could be pausing. It could be, as it noticed there on the slide, it says share participation is great. In an assembly, having a bunch of people help conjure the moment. In the African-American worship tradition, there's a lot of singing that goes before the central event, in that case, which maybe preaching takes place. And then these are kinds of action steps. And I'm just going to kind of walk my way down the list, but notice the thing. It's like, what is the doing? And I think sometimes people undervalue saying a prayer or taking time in meditation. It's as if we have to have a candle or burn a piece of paper or play a piece of music. All those are fine, they're great. But sometimes also, I know in the administration of funerals in my many years of ministry, there are prayers for the care of the community and the commendation of the dead into the hands of God that are the action, the central action in many cases, because often today the burials are just cremains that happen later and after and out of sight. But it's those prayers that are essential for the community to feel like they've done something. Bathing, anointing, burning, lighting, shredding. In the campus that I'm on, I can't light anything. So I either have to use electronic candles or a shredder. And I was very reluctant to do that initially. And I know it's become so much a matter of course. I actually think the shredder is kind of cool. It has a kind of a sound that is great. Always have to be conscious of the dangers of touch, but embrace your handshake where and how appropriate. Donning clothing or taking it off. Ritualizing divorce with the taking off of a wedding ring. Never. I'm away from my ring, but those are ways that ritual can have meaning. Singing, all those things, and then saying something as simple as "Thank you for coming. The ritual has ended. Go in peace" is fine. Like that's simplicity, courtesy, and hospitality are pieces of ritual practice. Sensitivity to different people's forms of experience. But also the closing words, if there is something that was supposed to have happened here, in the wedding service, the closing benediction that I usually offer is two parts, one to the couple, to their new life, and the rest of the community to continue in fidelity to their covenant relationships. So, you can shape it depending on what is there. But just like at the beginning, we have to know when it started. It is helpful and important to let people know when it's over. And sometimes that awkward trickle out at the end, unless it's an intentional part of the design, which can work, especially in like a Good Friday service or something that waits for Easter. But generally, it's helpful to have a bell or the extinguishment of a light or an announcement or a blessing or sending forth that let people know we're finished. And here's just a couple of quick examples that I want to say are important to understand. That I worked with a fellow named Father Bill Holtberg. I don't know, there may be people on the call who know and knew Father Bill. That's not a picture of him, but the picture calls him to mind. He worked in Korea and Vietnam as a battlefield chaplain, and watching him work individually with patients in our context made me appreciate what I call the micro ritual. The opportunity to, in a very, very few moments, take someone through the whole form. Greet them, deepen, provide a prayerful action of some sort, may even be a pat on the shoulder or an encouragement to a simple form of prayer. And then, you know, like a kind of like camaraderie laden, I'll see you on Sunday morning kind of thing. And to restate what I said at the beginning, maybe this session could help you think about every encounter that you have in that kind of a way. That every clinical encounter that you have has a beginning, a messy middle, and an end, and has a sacred quality because you're a sacred practitioner. These other things I've talked about already, grief rituals like letters, forgiveness, and reconciliation. But the other thing I want to say is complex rituals with nested or sequential forms. So if you go to a 12-step meeting and at the beginning they have opening prayers and readings, and near the end they give out coins to milestones and anniversaries and sign people's slips or whatever, those individual components, like the coin component, is a mini ritual within the whole ritual form. And both pieces have the ritual shape. So the overall meeting shape has a beginning, a deepening and action component, and a closing. And then the coin thing has a, okay, we're going to get our coin person, and we give coins for this reason, and then the giving of coins itself, and then we're done with the coins, is how that works. So when you want to say, oh, this ritual doesn't really follow the form, it may just be that it's a nested or concatenated instance. So that's my big genius sharing for you. I know I see another question. I'm going to take a look and see what it is. I couldn't see it because it was below off screen for me, but I'll take a look at it. And if there are any other questions, I encourage you to shoot them now. But the 4 words there, start, deepen, enact, and send, is something I think is really a way of understanding ritual process. So I'm going to say I've answered this first question because it was about my misspelling Al-Anon. How do you keep rituals from losing meaning? Sorry for this example, but I think it illustrates my point. A Catholic Mass is full of rituals, but many people pay no attention to it. They are going through the motions. I love that question. And so Richard, thanks for asking it. And 2 things that I think can help. One is that the facilitators have a great amount of responsibility in whether repeated rituals lose their meaning. So you can't entirely prevent the attendees and participants from becoming routinized to it. But what I think often is the fail is more the people who are in leadership around the ritual that may also become kind of tired of it or walk it through. And bringing small innovations or shaping it in different ways for the seasons, like that's a way. I have certain ritual pieces that I do, but I do it with different audiences, and I have little elements that make it for young or old or male or female or whatever, and that helps keep it alive for me, and it helps keep it alive for others. I don't think you can always prevent people from failing to enter the ritual experience. So I really do respect the question, but those are a couple of tips I would offer as ways of thinking about it. And I have one other question here. I'm gonna do the last question first, and then I'll go back to the third question because it's long. Somebody asked about PowerPoint. It will be available to us, and the whole session will be also recorded on YouTube. So if you want to go back and refer to it, you're going to be able to look at it. And Jesse, who's our web guru, is going to make the session available. So so that's cool. I'm going to mark that as answered. I'm happy to make this available. I'm a certified, Susan says, she's a music therapist, supervises students. We already use songs as ritual at the beginning and ending of sessions, but now we'll think more deeply about it. Has this been recorded? So indeed it has. That's great. I thought that was going to challenge me, and somebody else is just saying thanks. So I'm really, really grateful. This has been super helpful to me to have this chance to kind of share with you something that's been a big part of my passion for many, many years. If you do have more feedback, I'm sure that there'll be a vehicle to get it to me, and some of my contact information I hope is in the presentation. Jesse's going to send you a survey and also going to give you some information. Ask you to provide some of it, but he'll let us know also how to access the material. It was really a privilege to be with you. And Jesse, whenever you're ready, you can jump in. Thank you also.